If you have the authority to change or to improve the Thai healthcare system, what would you do?
There are a number of challenges at the moment. The health coverage system is often underfunded. I think you have to recognize that in health, the expectation of ordinary people about what they see as basic services is not static. Many procedures that were seen as luxury in the past is now seen as necessary. And when it comes to matters of life and death, it's very difficult to convince people that this is not for you. So we have to make sure both the universal health coverage system, the social security system, if it's not going to be integrated into this main system, is adequately funded. And to do that, it's important to do a couple of things. The first is that the allocated budget must be guided by a formula that is scientifically based, and we must try to reduce discretion as to how much or how little the government this year or next year we want to give. So we have to make this calculation as automatic as possible to make sure it's adequately funded. The second thing is cost of healthcare personnel should be separated from the funding of coverage for people accessing healthcare. That will help make sure that the medical profession and the health services staff who are very stressed in their jobs now get a fairer deal. I've seen the numbers concerning the hours worked by nurses and so on. It just isn't fair, and we need to make sure that they are adequately compensated. The third thing, we should now move to a more detailed, if you like, healthcare services for particular sectors. So for instance, we should now be targeting the health of children to be born, which is to say we have to give the rights to pregnant women to have access to certain things to make sure that the child is born healthy, and also rights to have testing and monitoring, mammograms to detect cancers and so on. These, we need to be more detailed now, to be more responding to the various niche demand of particular groups. That should be the next stage of the healthcare system. We need to sort out the mess in Bangkok as exposed by COVID to have a more unified system, and where I think private hospitals have played their part in a more equitable fashion when there is a crisis or a pandemic like this one. And again, strengthening what was already a success in the past concerning preventive healthcare and engaging people as part of the healthcare process. The healthcare volunteers, given new challenges that are coming up, they will need to be used to take care of elderly people who are not going to be looked after in hospitals, but in their communities or on their beds in their homes. Much more. There will be a huge increase in demand for that.